Hi, this is Dr. Jessie at Resonant Frequency Medicine, and I want to share with you one of my favorite tools for activating and stimulating the vagus nerve, and it is a weighted tuning fork. This particular weighted fork is the Sonic Slider by Biofield Tuning, and this one has a contour boot compared to how some tuning forks come. Most tuning forks come without a boot, so this one has a little added boot that enables the sensation to be a little gentler and enables the fork to slide. And you don't have to use the Sonic Slider. I just like it. It's a harmonic of the Schumann resonance. There are many, many, many other sizes and frequencies of tuning forks that you could use, but personal favorite, and what I have noticed when I give my clients a choice of which fork they like when we do this work on the table, they often like the Sonic Slider best. So that's why I'm talking about it in this video. To stimulate the vagus nerve utilizing your tuning fork, you're going to strike the fork at the weighted end on the heel of your hand so that you get a nice vibration. You don't hear it unless I put it right up close to the microphone, and that's because the weights dampen the sound, but it's still giving you vibrational input. And then I go right behind the earlobe and just set the fork there, and it's really a nice sensation. It vibrates the bone behind the ear, the mastoid, and also the occipital region. And then you come down from that space just inside the sternocleidomastoid muscle. The big ropey muscle, you're tracing just inside of that muscle down to the clavicles, and pausing at the clavicle gives a really nice vibrational sensation that kind of permeates the chest and the rest of the body. You can also stimulate the vagus at the level of the manubrium at the top of the breastbone. The manubrium is a nice way to stimulate, and you can even run the fork all the way down the breastbone, which has some contact with the vagus nerve behind the breastbone at where it branches at the carotid arch and into the heart and so on. So you can really do this in a lot of ways, but maybe let's give you some parameters to start with. 5 slow sweeps from behind the ear inside of the SCM muscle and stopping at the manubrium until the vibration dissipates on each side. Breathing deeply. And then just naturally with this vibration happening, my body is like, ooh, I should hum too. So if you want to add humming to this exercise, you certainly can. So 5 each side. And then really just trust where your body is asking for the fork next and go there. So for me, it's like, ooh, let's linger right over the heart space. That feels really nice. That was a little bit of an aggressive strike of the fork. So you can combine your humming with your vibrational therapy with the forks. And some signs that your vagus is activating: a yawn, a sigh, a swallow, a deeper breath, a sense of peacefulness, a sense of relaxation, a sense of safety, a sense of your peripheral vision getting wider, relaxation in the face. Those are all things you're looking for to indicate that you have successfully stimulated your vagus nerve. You can also check your pulse, because your pulse should decrease as we activate the vagus stimulation. It's called the vagal brake. It puts on the brakes for the pulse, so you should get closer and closer to 60 beats per minute as you increase stimulation of your vagus nerve with the tuning fork.